Now it is about ankle joint. Type of joint, synovial variety mean hinge joint. Type of joint is synovial variety hinge joint. Atlas surface, proximally distal atlas surface of the tibia. Suppose this is our tibia, distal atlas surface of the tibia, distal atlas of tibia concave, and then lateral surface of the medial malleoli. Lateral surface of the medial malleoli, it is flat. It is flat. And then medial surface of the lateral malleoli. Suppose here taking here medial surface of the lateral malleoli. Concave surface of the tibia, concave surface of the lower end of the tibia. This is concave surface. This is concave surface. And malleoli, what we are having here, tibial malleoli, otherwise medial malleoli, and here lateral malleoli. These two malleoli will be like flat only. So here the concave surface is this formed by the lower end of the tibia. So the shape which is formed by this concave surface of the lower end of tibia and flat medial malleoli, flat lateral malleoli, this shape will tell it's like mortise. This shape is called mortise. So this is superior atlas surface, proximal, and distal surface of the thallus. And so simply we can remember here. So here thallus is going to hum here. So arthrokinematics for here will be having two movements only, dorsiflexion and plantar flexion. Dorsiflexion, posterior gliding. If we give posterior gliding, it is going to increase the dorsiflexion range, and then plantar flexion, anterior gliding is going to increase the plantar flexion. Suppose we are having, suppose this is our ankle. This is our ankle. Remember only ankle. Okay, this is anterior. This is posterior. Ankle. This is anterior and this is posterior. Otherwise, we can see here. This is posterior, anterior and posterior, anterior and posterior. Dorsiflexion. This is our dorsiflexion movement. To get dorsiflexion movement, we should give here posterior gliding here. To get plantar flexion movement, we should give anterior gliding here. That's it.
We are going to see the ankle joint mobilization. So first we have to do the ankle joint distraction. For that we have to hold the calcaneum bone and another hand should be in the below the both malleoli. We have to hold tightly. Now we have to give the distraction with both the hand. This is the ankle joint distraction. Ankle joint mobilization posteriorly. For that we have to stabilize the lower end of the tibia and fibula, and another hand should be in the below the both malleoli. So first we have to give the distraction and we have to do the posterior glide of the ankle. This way we have to do the posterior glide, posterior mobilization of the ankle joint. Anterior glide of the ankle joint. So first we have to stabilize the lower end of the tibia and fibula, and another hand should be the near to, we have to hold the calcaneum bone. Ankle should be in the neutral position. Afterwards we have to give the distraction to the ankle and we have to put the force anteriorly. This way we can perform the anterior glide of the ankle joint. Method to do anterior ankle glide. Patient should be in a pronate position and we have to stabilize the lower end of the fibula and tibia, and in another hand we have to hold the calcaneum below the both malleoli and we have to give the distraction. After that we have to do anterior glide. This way we can perform the anterior glide of the ankle joint.